Hello everyone, welcome back to my channel. So in this video we will be discussing about drugs which are used in gout. So gout is a disorder of urine metabolism in which the plasma urate level, urate or uric acid salt, is raised either due to the overproduction या तो बन ज़्यादा रहा है या impaired excretion या कम हो रहा है, कम निकल रहा है. Okay, so the normal urate level is 2 to 6 mg. So there is a classification of gout. So gout attacks, they are being classified into two, acute or chronic. So which attacks we will call as acute gout? When there is a sudden onset of severe inflammation and on the small joints, जैसे कि the commonest one is metatarsopharyngeal joint, in which the joint become very red, swollen, extremely painful, and require immediate treatment with strong anti-inflammatory drugs without attempting to lower the blood urate level. Okay, so in this video we will be discussing about the drug therapy used in acute gout. Okay, so first drugs which are used are non-steroidal anti-inflammatory drug to relieve an acute attack. NSAIDs like naproxen, indomethacin, piroxicam, diclofenac are used, and these are quite effective even the terminating the effect. Majority they prefer NSAIDs over colchicine. Okay, naproxen and piroxicam specially inhibit the chemoattractive migration of leukocyte into the inflamed joint. Okay, so there will be no release of cytokine and other things. So now the drug that is colchicine, it is an alkaloid. It is non-analgesic or uricosuric agent, although it relieves the pain. So it is only used in uric acid in the treatment of gout. Okay, colchicine prevent release of chemoattractic factor orally and intravenously when it is given. Rapidly acting है, but it is poorly tolerated. So because it causes nausea, vomiting, diarrhea, abdominal pain, that's why majority of patients they prefer NSAIDs over colchicine, right? Because of poorly tolerated. Okay, chronic use may lead to myopathy, aplastic anemia, agranulocytosis. Okay, so you can see the formation of uric acid, hypoxanthine. It has been converted into xanthine by the enzyme xanthine oxidase, which is being inhibited by allopurinol and febuxostat. So we will be discussing about them in chronic gout. Okay, next video. So xanthine has been converted into uric acid. So there is hyperuricemia. So there will be deposition of urate crystal in joint, kidney, soft tissue, etc. And there will be release of cytokines by macrophages. Okay, which will cause the activation and migration of neutrophil to site of inflammation and release of mediator. So what colchicine does is it inhibit these two steps: activation or migration of neutrophil to site of inflammation and release of mediator. So there will be no decrease in pH and there is no deposition of urate crystal and destruction of joint. So colchicine is rapidly absorbed orally, partly metabolized in liver, excreted in bile, undergo enterohepatic circulation, ultimate disposal in urine and feces over many days. Okay, now corticosteroid. So these are the last choice. Glucocorticoid are effective and they produce rapid response, and they are reserved for cases which are not responding to NSAIDs or colchicine. Prednisolone and methyl prednisolone are used systematically in gout. If a single joint, अगर एक joint की दिक्कत हो रखी है, so we can give an injection, intra-articular injection of as soluble steroid like triamcinolone, acetonide or 10 mg in small finger or small joint and 30 mg in wrist. It is very effective. Okay, so that's all for this video. Thank you for watching and please subscribe to my YouTube channel.